Assalamualaikum and salam sejahtera to Sir Farid Ahmad and my fellow coursemate. My name is Muhammad Anwar Rizwan. My metric number 2020-856068 and I am from class RSR 245-2A. Today, I would like to talk about cardiopulmonary resuscitation, or also known as CPR. What is cardiopulmonary resuscitation? The meaning of CPR is cardiopulmonary resuscitation is a first aid method that works to restore adequate blood flow and oxygen levels to the lungs, brain, and the other vital organs. This procedure involves chest compressions and mouth-to-mouth breathing assistance and is very important as it can save a person's life. Performing CPR at an immediate rate can increase a victim's chance of survival up to 3 times higher. Now, we move to the step on how to do the cardiopulmonary resuscitation. Firstly, the first step to do cardiopulmonary resuscitation is when you arrive at the scene, please check the scene for safety. If the victim is found in the middle of the road, get help to move the victim to a safer place. If it appears the victim has an injury or is worried about the broken bone, it is best not to move the victim as it can result in more serious injuries. Secondly, check if the victim is conscious, semi-conscious, or unconscious. Note whether the victim has a reaction. If the victim is unconscious, try to move the victim or pat on the shoulder and call the victim out loud. Hello, are you okay? Hello? The next step is check if the victim is breathing. You can judge by observing whether the victim's chest is moving up and down or static. You can also bring your ears close to the victim's mouth and nose for 10 seconds to check whether there is exhalation or not. The next step is check the pulse. Check the victim's pulse at the wrist and the side of the neck to ensure the victim's heartbeat for a few seconds. The next step is ask for help. If you notice no movement or the victim's breathing has stopped, please call emergency unit 999 immediately and begin the CPR procedure first while waiting for paramedics to arrive. Hello there, please call 99 now! The next step is use automated external defibrillator AED if available. Before initiating chest compression, the rescuer can use an AED to analyze heartbeat and advise the rescuer whether to deliver a shock current to the victim. If AED is not available at the time, do not waste time and continue with chest compression. The next step before do the chest compression is locate your hand position properly. Place the heel of one hand on the center of the chest. Place the heel of one hand on the top of the first hand, then lace your finger together. Position of your body so that your shoulders are directly over your hand and keep your arms straight. The next step to do cardiopulmonary resuscitation is start the chest compression. Chest press with high quality as follows. Firstly, speed 100 to 120 per minute. The depth is 5 to 6 cm. The next, make sure the chest recoils to its original position before pressing again. Reduce interference when pressing the chest. Chest pressure and respiratory resistance ratio is 30 pressure to respiratory edge. And finally, each breathing, add for 1 second. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Next is open the airway. After perform 30 chest compressions, open the person's airway using the half tilt chin lift maneuver. Put your palm on the person's forehead and gently tilt the head back. With the other hand, gently lift the chin forward, open the airway. After that, prepare to give 2 rescue breaths. Before give the rescue breath, please apply the CPR face mask if available. This is only for example, CPR face mask. Give the first rescue breath lasting 1 second and watch to see if the chest is rises. If the chest is rises, give a second breath. If the chest doesn't rises, repeat the half tilt and chin lift maneuver, then give a second breath. For example, like this. Apply the CPR face mask and give a first rescue breath. Finally, continue doing CPR until there are signs of movement or emergency medical personnel take over. That's all from me. Thank you. 30 chest compressions followed by 2 rescue breaths is considered 1 cycle. Be careful not to provide too many breaths or to breathe with too much force. The conclusion for this assignment is knowledge of cardiopulmonary resuscitation is very important to learn because it can save lives in certain emergencies. That's all from me. Thank you.